Vaccines in pregnancy. Whooping cough vaccine. Whooping cough is a highly infectious bacterial infection that affects the lungs and airways. It can be life-threatening for babies. The whooping cough vaccine is recommended during pregnancy and helps protect your baby in the first few weeks of life until they're old enough to have their own vaccines. The whooping cough vaccine is recommended as soon as possible from week 16 of your pregnancy. This is to help your baby build up enough protection before birth. The ideal time to have the vaccine is between week 16 and 32. You may still have the vaccine after you're 32 weeks pregnant, but it may not offer your baby the same level of protection. You can find out more at nhsinform.scot/vaccines in pregnancy.